Other hospice nurses might disagree with me. Giving medication for a death rattle helps minimally, if at all. Although terminal secretions, also known as the death rattle, are not harmful, nor do they cause discomfort to a dying person, families often worry that they are going to drown in those secretions. I can promise you they will not. In the 20 years I've been a hospice nurse, I don't know of one single person who ever died by drowning. Still, it's an awful sound that causes a great deal of stress for the loved ones of the dying person. We can give medications for the sake of the family, but as I said, they're not usually very effective, and they can dry the person's mouth out. I've seen tongues that look like a big, cracked, swollen dry brick. That does look uncomfortable. There are a couple of things that are more natural that can be done. As the person is nearing the end of their life, pay attention to their body's cues. If they're having difficulty swallowing, avoid giving them too much fluid. The more fluids in the body, the more secretions. Instead, give them ice chips or a damp sponge on a stick to suck on. Once the secretions start making noise, positioning can significantly help to quiet them down. I've found what works best is raising the head of the bed up and putting people onto their side. Either side, it doesn't matter. Lastly, try to keep in mind it's really just a noise. It's not going to hurt your person, and it won't go on for long. Terminal secretions are a strong predictor of death. Most people who develop a death rattle will die within 48 hours.